Studies show that more than 2.7 million kids aged 12 to 17 suffered from severe depression last year. Mental health challenges in children have become more prevalent in recent years, and that's why a local group is launching an initiative to provide free mental health care. Chris Atkins with the LJD Jewish Family and Community Services Program joins us right here. So let's talk about Project Launch. We'll do that in just a minute, but first let's talk about the problem. Okay. I don't know if it's become more prevalent or we're becoming more aware.
I would definitely say we're becoming more aware. Kids out there now, between 1 in 6 kids between 8 and under have more likely a chance of mental health diagnosis, behavioral diagnosis, developmental diagnosis. So the stuff is out there to diagnose these kids early on, but not all the resources are out there for parents to know where to go to do that.
I don't want to cast aspersions here, but I think too many parents have their heads buried in the sand.
Well, I think it's important that we recognize when our kids change severely from their normal routines. They're not sleeping well, if they're frequently getting sick, if they've got headaches, if they've lost interest in things that they normally very much enjoy, that's a big sign for parents to say, there might be something going on with my child, and I'd recommend them to go see your pediatrician, reach out to services to see what is out available.
You know, you talked about some of the obvious signs, and I said they have their heads buried in the sand. And maybe it's also that they've got their priorities mixed up. I know parents are, look, I had 4 boys, you know, and it's easy to talk about priorities. We're busy with work, we're busy with other things, but they're really, I don't want to preach here, there's nothing more important than our kids. And we've got to take the time to recognize those signs.
Well, and that's why Jewish Family and Community Services decided to apply for this grant, to get Project Launch, to start bringing in mental health services to families at the home. We're going to remove transportation as an issue, where this is a free mental health program for parents who have kids 8 and under. And the idea is we get into the home and work with those families to help them understand what's going on with their kids, what signs do they need to notice, what they can do to support their children so that they don't get a diagnosis of anxiety or depression or are falling behind in school. You know, kids that have anxiety or depression at an early age through trauma, through grief, their literacy scores suffer, their math scores suffer, their language skills suffer. And we want to make sure that these families have the resources so that way their development is right on track.
And there are a lot of people that let their kids bury their heads in social media. They use social media, computers, and things like that, the TV as a babysitter. Yeah. I remember when I was growing up, my parents had 2 rules. Number 1, Dad was like, don't make me ask if I did your homework. Number 2, we had a set dinner time. We're all going to sit around the table and we're going to talk about our day. So my parents were very clued in to what was going on in our world. So there was this open line of communication. Yep. And by listening to what we were doing, my parents were clued in to what was going on in our lives, and they knew about those signs that you were talking about.
Yep. Well, I think it's important that we established consistent routines for our kids. Because if you don't have that consistent conversation with your child, how are you going to know what they're going on with? If you're not sitting down at dinner at least several times a week, 2 or 3 times a week, to talk to your kids, even when they're 3 and 4 years old, you're not going to know what's going on with them because they're not going to necessarily just tell you. Their behavior might show it, but if you've got work and school and other things going on, it's hard to just figure that out. But if you're regularly talking to your kids, you're scheduling time to sit down to have dinner, you're scheduling time just to play with them on a Saturday morning, your kids are going to show and tell you through their behavior and some of their words what's really going on.
And is there sometimes this, I'll use the word denial, you know, maybe you're talking to some of your kids' friends, or you hear from the teacher and then there's this, not my kid.
Well, no one wants to think that there's something wrong with their child. That's natural. What we want to make sure is we're trying to be preventative. There's nothing wrong with asking questions, and if you're concerned, go see your pediatrician. They will get you to services, and I encourage people to go to our website, jewishjfcsjax.org. If you want to inquire, we're happy to answer questions. We're happy to advise, and we can easily connect them to services if they're interested.
And what if your child doesn't want to open up? Because there's a way to finesse your child.
There is, and if your child's not ready to open up, then just be patient with them. Give them that attention, give them time. They will open up eventually, but they need to see that you're interested. They need to see that you care.
Okay, patience is the key there. So the program is offering a free in-home mental health care program to all Duval County students, which is what you were just talking about.
Correct.
So it's Project Launch. If you're interested in enrolling, you can call 904-487-5802 or email projectlaunch@jfcjax.org. It's not cliche to say that our kids are our most precious resource, and family is the most important thing.
I agree.